Well, what gets me going is the opportunity that patients give me to be a part of their life and to maybe help people obtain some insights and some clarity that bring about healing. You know, people who suffer the disease of addiction, they take hostages, basically. You know, anybody who cares about these people suffers just as much as the person suffering the actual disease. You know, it's hard for loved ones to stand by and watch people that they care about suffer and slowly kill themselves or destroy their lives in countless other ways. And so I feel like the amount of suffering that I'm able to touch in some way is actually bigger, it's more profound than with sort of typical medicine, because there are just so many people who are brought into this fight, and there are so many people whose emotions ride on the outcomes for these patients. People come to treatment for addiction or alcoholism with a lot of denial. The whole disease of addiction is really based on denial. This is a disease where people do things to themselves all day, every day that's hurting themselves, and they're convinced that they don't have a problem. It's the only disease that I know of that actively tries to convince people every day that they don't have a problem. So I consider that a challenge and an opportunity because people will sit down and share with me details from their lives, tremendous amount of pain, emotional pain, physical pain, spiritual pain, traumatic experiences that maybe they've never shared with anybody else before in their lives. And when they share that with me, I have an opportunity to let them, to sort of hold up a mirror and let them see their lives as it really is, help them bring their problems into the light, and help them deal with those things. And maybe for the first time ever, have some insight into their disease process, have some realization that maybe I am sick, maybe I do need to change things, because like I said, this is a disease rooted in denial, and people usually don't see the problem until there's a real crisis in their life. I'm Dr. Joshua Smith, and I'm practicing addiction medicine at the Henry Ford Maple Grove Center.